Whether it's racial tensions, unrest, the coronavirus, or economic hardships, many of us are likely feeling anxious, depressed, and isolated right now. We want you to know you are not alone.
Prior to the coronavirus pandemic, more than 20% of Americans had symptoms of depression or anxiety. Researchers estimated that nearly tripled last month. Joining us now is Dr. Crystal Clark, a Northwestern Medicine psychologist or psychiatrist. Dr. Clark, thank you for joining us. What are the majority of the calls you've been receiving lately?
At Northwestern, in our outpatient clinics, we have been receiving more calls around anxiety and depression, a significant increase in the past week, in which we've had more new patients and more return patients asking for appointments. I would say that my patients in particular have been complaining of more anxiety as it relates to the protests and the looting in relation to George Floyd's death. And specifically, my African-American patients and those of others providers I've talked to, this has been a sense of a boiling point for them because they have been experiencing systemic discrimination for months, years, decades, centuries, really. And the recent events have been very triggering and causing more anxiety and distress for them.
Dr. Clark, what are you able to tell people?
Well, right now, the best thing I can tell them is really to validate their feelings. The anxiety and the distress they're experiencing is absolutely appropriate given the time that we're living in. I mean, so many had already been dealing with the stress of confinements and isolation due to the pandemic, and now the civil unrest due to the recent deaths of George Floyd and killings of George Floyd, Breonna Taylor, Ahmaud Arbery, and even the incident with Amy Cooper. All of these things have been triggering for many around our country and our globe.
Dr. Clark, you're talking about our homes. Ideally, they're supposed to be some of the safest places where we feel the best, but what are some of the coping mechanisms we can use within those areas when violence gets a little close to our safe zone?
Well, when I think about violence getting close to our safe zone and it being our home, I think about our entire country. This is our home, and we are seeing this across our country, and especially locally in Chicago. And what I'm advising people to do is number one, reach out to your circle of trust, your community, those people that you can process this with, whether that's family, friends, your church. And I'm also advising people to take care of themselves and to monitor how they're feeling. If these feelings are going on to the point of impairment, so feelings of anxiety or depression may be increased irritability, difficulty sleeping, difficulty concentrating, difficulty with your appetite where you're excessively eating or not eating at all, or increase in substance use or drinking alcohol, then these things, if they're causing impairment, the next step is really to reach out to a professional so that the person can get the help that they need.
Yeah, don't ignore it, right, Dr. Clark?
Absolutely, don't ignore it.
Yeah. Thank you, Dr. Crystal Clark from Northwestern Medicine. We know there's a lot of information on the screen here, but we wanted to make sure you have time to grab a pen and paper. If you need help, the city set up a mental health call center that provides free support. That number is 312-747-1020. Again, the number is 312-747-1020. You can also call the National Alliance on Mental Illness at 800-950-6264. Let's repeat that, 800-950-6264, or you can text the word NAMI to 741-741, and you'll be connected with a counselor.